Jacqueline W. Bryant, President of the Brunswick, Georgia chapter of the Links Incorporated. I bring you greetings on behalf of our chapter, and we are excited to be partnering with I Deserve, Inc. A little bit about the Links Incorporated. We are an international not-for-profit organization that was established in 1946. The membership consists of more than 16,000 professional women of African descent in 292 chapters located in 41 states, the District of Columbia, the Commonwealth of the Bahamas, and the United Kingdom. It is one of the nation's oldest and largest volunteer organizations of extraordinary women who are committed to sustaining and ensuring the cultural and economic survival of African Americans. Locally, we have 31 active members, 11 alumni members, and we serve Camden, Glenn, and McIntosh counties. We are actively engaged in our communities through our 5 national facets. Those facets are services to youth, the arts, national trends and services, international trends and services, and the reason we are participating here this evening, our health and human services facet. Through this facet, we received a grant from the Gilead Foundation to assist in bringing awareness of HIV to the communities. The grant is coined HELP, which stands for HIV, Education, Leadership, and Prevention Program. The purpose of this program is to address the disproportionate impact of HIV in the communities served by the Links Incorporated through our transformational programs. The program builds on existing successful models of community engagement at the chapter, area, and national levels to deliver impactful and sustainable programs through a variety of platforms and partners, one of which we are engaging here this evening. So please remember, we all need to work together to decrease the healthcare disparities that impact our communities regarding HIV. Again, welcome. We're happy to be here, and please prepare yourselves to learn as much as we can. Sharon?
Good evening, everyone. I'm Sharon Blue Lee, and I am co-chair of the Health and Human Services facet. And before I talk a little bit about that facet, I'd like to ask my other co-chair to introduce herself as well.
Good evening. My name is Michelle Drew.
Michelle Drew and myself work together on Health and Human Services along with our other committee members. And the facet was established by the Links Incorporated in response to chronic health disparities that persist in Black communities. More times than not, these disparities result in the decreased life expectancy of African Americans and other people of African ancestry. The goal of this facet is to promote and facilitate programs that support maintenance of good health and elimination of chronic health disparities in communities of color. Now, not only do we deal with HIV in this facet, we also deal with some other areas that impact communities of color, and I'd like to just share a few of those. Mental health, linkages to life, which deals with organ and tissue donations. We have a program called Health Equity Ambassador, and under that comes breast cancer awareness, heart health, and walking for healthy living. And of course, we also deal with childhood obesity and oral health care. So we have a lot going on under Health and Human Services, and we are very excited about being able to partner for this HIV event. So, G. Allen?
You can't hear me. Now you can.
Yes.
Hello, everyone. I'm G. Allen Battle. Thank you so much, Sharon. Thank you so much, Jacqueline. Thank you to Michelle and everybody involved who is here to make this happen. I'm your host for the evening, host and moderator for tonight's conversation. I'm the founder as well as the conference director of I Deserve Incorporated. I Deserve Incorporated is an organization that was founded to dispel the myth of unworthiness and undesirability. We believe that every individual on this planet is worthy of and deserving of good. As she mentioned earlier, they partnered with us for this year's Deserve Conference series. The Deserve Conference series is a series focused on whole self-wellness, and it's hosted by I Deserve Incorporated. And this year's theme is Minding the Heart. And every year, we always do a World AIDS focus, and that's where the links come in. And we thank you so much for joining us and partnering with us with this World AIDS Day focus throughout this week and throughout the rest of the month of December. Thank you so much. And so without any further ado, we're going to get started in this conversation entitled HIV in the Community, Everyone's Voice. I know that Sharon and Jacqueline have introduced themselves, but we have two other panelists, three actually. If you guys would go ahead and introduce yourselves at this time.
I guess I'll go ahead and go. My name is Katrina Howard. I am a former lead communicable disease specialist for the Coastal Health District. So I had a pleasure of working the front line when it came to HIV and AIDS for a decade. So it is definitely a pleasure to be here today to have these conversations. Thank you.
Thank you.
Good evening, everyone. My name is Ricky Perkins. I am the community health educator at the Coastal Health District currently, and my job is to, educate and advocate for people who have HIV/AIDS.
Thank you, Ricky. And finally, Michelle. Did I say your name correctly?
Michelle?
Yes.
Yes. I'm Michelle Drew, and I am a citizen, a member of McIntosh County, and a part of the Links Incorporated and educator in Glenn County.
Awesome. Thank you guys so much for joining us on tonight's conversation. I think this is going to be a really good time. What I'm going to do now is make sure that my phone is on silent because I would be the one to make that mistake. So there we have it. All righty. So diving right into this conversation entitled HIV in the Community, Everyone's Voice. The theme for World AIDS Day this year is equitable access, everyone's voice. I want you to keep that in mind, okay? So my first question to everyone is, why do you believe we need to continue this conversation about HIV prevention and care in the year of our Lord 2021? Why is it necessary that we still talk about HIV today?
If I can go ahead, it's very necessary to discuss this topic today in the year of our Lord 2021, believe it or not. Despite all the advances that we have in science and medicine, there is still a fear of disclosing the status. There's still a fear of being shunned, so to speak, from your community if you reveal what's going on. Much like if I can compare with COVID-19 right now, there was a big issue about whether or not you were vaccinated or not. And we still have people on either side because we're now, have you received your booster shot or not? So are you HIV positive or not? It's kind of like you're separating, and we don't want that. We want everyone to have knowledge about what HIV is, what causes it, and how can we prevent it? That's the number one thing. How can we prevent it? Because in our community as African Americans, STD is still prevalent in our community, as well as the number of cases of HIV in our community. So if we don't share the information, because knowledge is power, then we will still have increase versus decrease. So if we stop the conversation, then we will not make an impact on our community. And also we talk about equity. We want equitable access to healthcare. If they don't share, they think it's a stigma because if someone sees me go get tested, then they already know that they think that I'm positive. And that's not necessarily the case. So what we have to do is remove the stigma, make sure that everyone has access to testing, make sure that everyone understands what type of medicine or help is out there and available in the community, because most people don't know. So that's why we have to continue to this conversation.
Thank you. Ricky, if you don't mind chiming in, I know you currently are working as the community health educator for the Coastal Health District, and you work very closely when it comes with HIV prevention and all of those efforts. Why do you believe it's necessary that we continue this conversation?
I believe we should continue this conversation because it is an ongoing matter. I mean, I see it pretty often, especially like, going to colleges or going to other testing events and trying to get the individuals to talk about it, and I always ask the question, well, what do you know about HIV? And they're like, well, I know, people they've died from it, or I know that you can get it through sex. And so then it poses other questions. Well, how else can you get it? Or, well, what brings you here? So I do feel as if, it's something that's ongoing. It's something that people are diagnosed with every day. People are battling this right now. And if we don't talk about it, then who will?
Thank you. And lastly, Katrina, if you would round this off for us, why do you believe that it's necessary that we keep talking about it? Why do we need to keep bringing up HIV in 2021?
Well, I think back when World AIDS Day was initially observed in 1988. We are now in 2021, and so much has changed, but there's still a barrier, lack of education. You think about it, I can remember working as a communicable disease specialist, and so many people ask me initially when they're diagnosed, how long do I have to live? The lack of understanding. I tell people all the time, this is just a diagnosis, you have life after a diagnosis, and people don't understand that. So we have to continue the conversations. Everything that everyone has said is great. I also see that we have to educate our politicians, right? We have to educate our school systems, because right now there are barriers, there are laws that are in place that does not allow the Coastal Health District to come into the school systems and provide education, right? So not only are those who are at risk, but people who are in high positions need to continue to be educated, because they're making decisions that affect the community. There really are some barriers that doesn't allow the Coastal Health District to do their job. So everyone needs to be educated. We need to put it on the forefront so we can come together as a community to stop this pandemic, this epidemic that we're experiencing right now. So thank you. That's all I have.
Absolutely. Thank you. And I would just piggyback off of that. I really do believe that it's not time. This is not the time to stop, especially with our goal being to end the epidemic. We want to see zero in 2030. And in order to make sure that that happens, we've got to have that equitable access, which I think is such an apt word because it means fair and impartial. And so often that's the issue that we run into when it comes to prevention, when it comes to care, because unfortunately, especially when it comes to public health, certain communities only have certain options when it comes to care. I'm going to say it just like that, but we understand what I'm saying. And so we've got to figure out a way to bridge that gap, to bridge that divide, and so that it can be fair and impartial access. I'm going to move on to the next question, and this is for Ricky and Katrina because you guys really work in this field. Simple question, but today we still have to ask this. What is HIV? What is AIDS? Are these terms interchangeable? If not, what's the difference between the two of them? Let's talk about that.
Well, I'll start. The terms are not interchangeable. Let me start there, because I hear a lot of people say, when we're initially offering the test, oh, I don't want an AIDS test, or we were at an event yesterday, and the person that was sitting behind this, she's, trying to connect me with someone as a contact, and she tells them on the phone, well, they're offering AIDS testing, and it's like, oh, like, that's not correct.
Say that phrase for one more time. You broke up.
I said that they're offering AIDS testing. That's what she said to me. Or no, that's not what she said to me, but she said over the
Katrina,
phone.
while he reconnects, if you don't mind continuing that.
Oh, okay. So it sounds like what Ricky was trying to say. There's a stigma behind HIV and AIDS. Oh, you getting an AIDS test is what he was trying to say. Ricky, are you back in? But
am I back? Y'all can hear me?
Yes.
Okay. I'll let you finish what you were saying.
You gotta love technology. Gotta love it. Go ahead.
But I was just, so taken back by what she said.
Now, what did she say? Tell us that one more time.
She's on the phone and she's like, they're offering AIDS testing. And the fact that, I hear that so much, it's like, well, you guys really are not educating yourselves. And that was a teachable moment. But, also I'm at an event, I'm working with the clinic we were at. But HIV is the virus. Human immunodeficiency virus is the virus. AIDS, acquired immunodeficiency syndrome, is essentially the syndrome or the condition, that it happens whenever, your white blood cell count has dropped below 200. And you can't come out of AIDS status once you have reached AIDS status. You can't, name-wise, you can't, but you can revert back, your white blood cell count levels can be back in a healthy state.
Yeah. And to piggyback in what Ricky is saying, HIV and AIDS are completely two different things. It's almost like looking at stages. You have stages of cancer, you have stages of diabetes. Mm-hmm. There are patients who I have come in contact with that never developed AIDS status. They were diagnosed with HIV, but they're living healthy lives. They're taking their medications, and AIDS is never anything that they've had to be concerned about in 10 plus years. I think AIDS became a stigmatized name in a sense, because, back in the day, you would see someone walking and you, oh, I hear they got AIDS. It's like, it became a bad name, right? Mm-hmm. And that's, which is not good. It became the entire name of the disease, and that's only a portion of it. That has nothing to do. Most people don't even face AIDS. It's totally two different things, And so I try to, when I explain it to people, I explain it that way. Think about the stages of other health conditions as in reference to HIV and AIDS. They're totally two different things. And like Ricky has said, you've had people diagnosed with AIDS because their T cell counts get so low, but guess what? They recover from it, right?
You can recover.
They start taking their meds, doing everything that they need to do for their body. They can't change that clinical diagnosis, but health-wise, they're doing amazing. And so I celebrate those. I celebrate people who are undetectable, who are having life after a diagnosis. That's the main part. So I don't, to anyone looking at this today, stop using words AIDS, because it's bigger than what you see. Okay. Unless someone tells you, yeah, I've been diagnosed with AIDS, then that's a different ball game. But for the most part, HIV is the proper terminology.
Absolutely. Absolutely. The way I like to talk about it, when it comes to the whole stigma of it all, is that we had this same issue back in the day with cancer initially, because we didn't know where it came from. We didn't know what it was. We just knew that people it was told that they had these tumors or they had cancer, and then they were dying, and we didn't know what was happening, and it could affect any part of the body. We were so concerned, and this stigma arose because of fear and misinformation. And just like that stigma has been reduced, you don't hear about stigma as it pertains to cancer now. You don't run into that type of stigma. When you find out somebody has cancer, you find out if they're in treatment. You know, if they're not in treatment, you do what you can as a as a loved one, as a friend, as a community member to get them connected to care. You know, are you going through dialysis? Are you doing chemo? What measures are you taking to take care of this cancer diagnosis that you have? But there's not that fear surrounding it. So we don't mind getting those tests and things of that nature. You know, there's the natural fear about being sick, but at the same time, there's not that community fear or that community lack of knowledge or lack of information that is projected upon an individual as it is with HIV and AIDS. And I believe that just as we've reached that point where stigma was eradicated as it pertained to cancer, I believe we can do the same thing with HIV. I do think it's going to take a little bit longer, though, simply because if we're being realistic, especially in places like the Bible Belt, and with the U.S. being a country that is predominantly Christian, I'm a Christian. When you think about a virus that we associate with sex, and for some reason, because we vilify sex, which is very odd, because it's a natural thing, and hopefully it's enjoyable for everybody who's partaking. Like, we should be thinking about it in those healthy matters, but that's not the way that we do it. And so when you take the virus and you associate it with sex, then oftentimes there is going to be that stigma surrounded or as it pertains to behavior and things of that nature. I want to move on and ask another question that is not listed on here, or start a kind of discussion that is not listed here. Katrina mentioned earlier that sexual education in the state of Georgia specifically, where we are, and specifically in Glenn County, but since we're talking about since we're speaking with the links there in Brunswick, is limited to abstinence. Georgia is an abstinent state, and so our schools, if they teach sexual education, what they teach is abstinence. That means condoms are not brought in. That means protection is not brought in, because you don't need protection if you're not having sex. Katrina, throw some of your thoughts out there about that.
Oh, I have some thoughts.
I know you do.
My thing is, you can tell somebody they bet not do something, but guess what? They're going to do it anyway. So I don't like the concept of abstinence only method, because you're telling someone what they shouldn't do, but you're not showing them how to prevent if you do it. Mm-hmm. Our students need to know, simple as putting on a condom, knowing the expiration dates, knowing what's feasible for your body. Mm-hmm. That is not allowed. There are so many students who have come through our facilities and who tested positive for STDs, and they didn't know they could get an STD that way. They didn't know about protecting themselves. And we know mm-hmm. youth are having sex at a very probably young ages. They have the social
right. What is it? 14 to 18. And yes. Then what is the other age range? I think it's like 50 to 65.
Yeah, so 14 to 18 is when it comes to gonorrhea and chlamydia cases, last when I looked at it, was mm-hmm. the highest rates. So if you have youth that young who are already testing positive for gonorrhea and chlamydia, they're doing the same thing. They could be exposed to the HIV, right? So I feel like our school systems need to set a foundation where they are at least starting the conversation. It's almost like I think now let me know, Miss Michelle, I can't remember. I think there is education about what STDs are. So they are educated about what the symptoms are, but they're not still informed or provided information about protecting. It's the preventive measure, from my understanding, that is not.
It's the preventive measure.
Okay. Yeah. So that is my thought. I think that with state of Georgia having rates as high as we have, we're contradicting our data.
Okay. Ricky.
Yes.
As it pertains to the whole education factor, because I know when she said it, your face was like, right. Tell us about that. The whole us being able to provide sexual health education in its totality in the schools.
I know when I first started the job, I was trying to get into schools. So trying to get into schools bad, because I was like, I need something to do. I feel like this would be great. And I was hit with the, we're abstinent state. Like we can't go in unless, we clear it with the school boards, and we have to talk to parents, and we have to talk to the teachers, have to be comfortable. Maybe sometimes you can get a teacher, and it's like, I feel like you shouldn't have to go through all that. I feel like when I was in school, we learned about it. And we learned, like Ms. Katrina said, probably we taught about those things, but there were no preventative measures taught. It's just, hey, you guys don't have sex, or don't do this. Even like pushing it in church as well, it's like, well, don't have sex, don't do this. And it's like, well, it's too late. People are out here pregnant, people are out here STDs, people are out here, doing all types of things because it's too late. It's like your mom telling you not to touch the stove, the eye of the stove, and you touch it and you burn your hand. And it's like, well, I burnt this hand, but I'm gonna do this one now. So I think it's frustrating to me that I can't do a job that I'm supposed to do.
Oh, that frustration is so real. And I've seen you work in that field and be passionate about educating people. That's part of the reason why I have to shout Ricky out for a moment. He worked as an intern with me when I was the men's HIV outreach specialist there, and technically doing the job of a HIV prevention outreach coordinator. When I was there, he came on as an intern, worked as an intern for essentially a year. And the work that he's doing now is reflective of the work that he put in to make sure that he got educated on the matter. And he did things like going through media boot camp so he could have conversations like this via Zoom, on the radio, over television. So I have to commend you for doing the work. Michelle, you're an educator, and so you actually work in the schools. Do you mind? I know you can't say too much because that's your break. But am I correct in thinking? I believe that though we're an abstinent state, the state has left it up to the counties themselves to decide whether or not they will teach the full sexual health education. Is that correct?
I believe that is correct. And there are also committees that are formed in order to review topics such as this, much like we have reviews of textbooks and books in our media center, and you hear about those things also. So there's a committee that reviews, if I'm not mistaken, it's our Family Life Committee. Mm-hmm. And they review topics and books to see if they would be appropriate for various ages. And it is totally up to each district, but still meeting the minimum of the state's guidelines of abstinence.
Okay, which means they have to include abstinence as a method that they teach. Which hiking is, I mean, honestly, it's the best method. If you don't want to sexually transmitted disease, don't have sex. That makes sense. So then my next question would be, do we believe it's possible to kind of turn that tide? Because I feel like if we can communicate with enough parents, and I know several teachers who are like, we should do this. If enough of us speak up, do you think it's possible for that legislation to be changed, at least in the county, on the county level, county by county?
Mm-hmm. Anything's possible. I wouldn't limit it to.
Okay.
Mm-hmm.
I put that out there because
and when I say anything's possible, you look at when parents speak out and they're vocal about various topics. Yeah. Attention is drawn to it. So.
Yeah. Thank you. Mm-hmm. And that's literally my point. I feel like if we if everyone raises their voice, everyone's voice, right? I think we can make that change. I challenged Glenn County Glenn County, McIntosh. Yes, even McIntosh. Chatham County, Bryan County, all of the Coastal Health District, all of the other counties. I suddenly, Long County, I drew a blank for a moment. But I challenged them. Parents, start raising your voices. I'm not saying we have to teach your kids sexual positions and things of that nature. I don't think that's necessary. But I do think that they should understand the mechanisms, number one, of sex. The mechanisms as it pertains to their sexual organs and how they work and how they come together. Different types of sex as it pertains to gender and such, so that you know the percentages, the likelihood when it comes to contracting certain diseases, because there are certain types of sex that make you more likely or more prone to certain STDs and certain STIs, and so it's important to know that. Most people don't know that you can HIV can be passed orally via oral sex. We don't talk about that because it's oral sex. That's not really sex. It is sex. That's why you can get gonorrhea in your throat. It's very important for us to know those things. And so I believe if we have these conversations, we can, and if everybody is willing to voice their opinion, everybody's not going to agree. But if we can find some middle ground, because we've just gone so far right, I feel like if we can find some middle ground, we can really make some change. And we can see this goal of ending the epidemic by the year 2030. So when we have conversations like these, we love to ask everybody, included in the conversation, the same question. I deserve, our logo is broken down into an acronym where we remove all of the vowels except the I, and it's spelled IDSRV. So whenever you see our logo, you see that IDSRV. And it stands for I dream, speak, and receive victory. So in light of all of this that we've been talking about, when you hear the phrase, and this question is for everybody, when you hear the phrase, I dream, speak, and receive victory, what's the first thing that comes to your mind?
Triumph.
Say that again.
Triumph.
Yes, talk about that.
I just think about, trying, defeating something. I've overcome something. I've made it to the other side.
Come on now, don't take me to church.
That's, just thinking about, I remember when I was in college, I used to always have this, probably more than likely anxiety, but I used to always think I contracted HIV. It was just always a thought, and now I've moved on to, okay, well, I know my status. I know what I am able to do. I know the knowledge. I've educated myself, especially to do my job. But, I've overcome that. Now it's not really, it's sometimes it's in the back of my head, but more so, it's like, well, I know that there are other options.
Wonderful. Anybody else?
I think about when I dream, I speak and receive victory. At that moment, I thought about all of the people in my world, in my line of work, who thought they had a death diagnosis. At that point, I'm like, you got this, you got victory. So I say that to say, if there's anyone on this Zoom right now who live in fear, know that you have victory. Take control of your diagnosis. I speak it and I receive victory. I also think about the future. I believe we're going to come with a cure. I believe that HIV is going to be something that is treatable out of your system and you keep it moving, almost like another gonorrhea, chlamydia. Get your treatment and keep it going. I am believing in that. You hear me? We are going to come. We're so close. We are so close. People are living where their viral load is no longer multiplying in their body. To be able to say that your viral load is undetectable, we're touching the surface, and I believe we're going to get there. We're really going to get there. So I'm excited. I'm very excited to see what 2030 brings to this world, because we need it.
Thank you. Links. when you hear the phrase, I dream, I speak, and I receive victory, what's the first thing that comes to mind?
I thought about a cousin that I lost last year to this disease and had no idea that he had it.
Mhm.
And when I thought about his life, he lived each day as if it were his last. To observe him and his upbeat personality, you never would have thought anything was wrong.
Mhm.
And once it became common knowledge what caused his death, it just caused me to reflect about what you're saying. You have a dream. You don't part by your successes. You don't accept it as a death sentence. You work each day as if it were your last to accomplish whatever it is that you want to accomplish. And that determines your attitude. And as they say, that determines also your altitude. And so he left a wonderful legacy by showing us how to live, how to enjoy life. He went out with a smile, I'm sure.
I love it. Thank you. When I hear the phrase, I dream, I speak, and I receive victory, I'm like Katrina. I see a day when this stigma, I mean, yeah, there's going to be some stigma because ignorance will always be around us. The Bible says that the poor will always be with you. That includes the poor in mind. So those who lack knowledge will always be around. Yeah, so there'll be some stigma, but the overwhelming stigma, I see it gone. I can see, I feel like we're right there at it. I can see, the cure in us getting to zero with no new diagnosis. I see that, and I believe it's possible. Um, I myself am HIV positive, and I live with an undetectable status, meaning that my viral load has been suppressed and it's not multiplying in my system. Um, I also have to remind people that because someone is HIV positive, it simply means that they carry a virus with them. It doesn't mean that they're sick. A lot of times when people are diagnosed, the first thing that comes to their mind is, oh no, I'm sick. It doesn't mean that you're sick, or it doesn't mean that your friend or your neighbor who is HIV positive is sick. It just means that they carry a virus. And that virus that is in their system, its designed, its goal is to take out your immune system, to make one sick. So that, because once our immune system is depleted, then our body doesn't have what it needs to fight. Then we become sick with something else, because even then you don't die from HIV, you don't die from AIDS, you end up dying from some condition. Oftentimes it's pneumonia or some type of cancer because the immune system couldn't do what it needed to do to fight the issue. And so I'm looking forward to the day when those types of details are clear. Just because you got an HIV positive diagnosis doesn't mean that you're sick. You're not sick. It's like carrying rhinoceros or carrying the flu virus. Everybody doesn't get sick. Everybody doesn't display symptoms. Everybody doesn't become ill, but they become carriers. And that is what that means. And so it's very important that we get that information. Parents, community leaders, people of all ages, it's very important that we have these conversations. My aunt was telling me, she's, how old is my aunt now? I think she's 70. Her girlfriends got together and they went out for brunch. And she said, I had to ask him. Greg, I had to ask him. She calls me by my first name. Greg, I had to ask him. Girl, when was the last time you got tested? And her friends were like, wait, what? Because these women are in their 70s and their 60s. One of them, I think, is in their 50s. And she was like, when was the last time you had your STD panel? When was the last time you got your HIV test? When was the last time you got checked for everything? Because I know you're sexually active. So when was the last time? And they had a very real conversation. I do not believe that this conversation should be limited to any age, any gender, any belief system, any race, any nationality. We all should be opening our mouths and speaking up, because it's when everyone's voices are heard that will reach that fair, that inclusive, and that impartial access. That's equitable access. Fair, inclusive, impartial. That is equitable access. I believe we'll get there. I know that we can, but we all have to speak up. All of us have to make our voices known. So I'll leave you with this charge. Number one, know your status. HIV can be passed and transmitted via sex, mother to child when it comes to birth, and it can also be passed with the use of intravenous drugs when sharing needles. So know the access points, know how you can get it, and know your status. If you find out you're positive, get into care. If you got questions and you don't know where to go, contact your nearest health department. If you live in the Coastal Health District, they have the best HIV team I have ever seen anywhere.
Thank you.
The best. I know this because I used to work with them. I'm telling you, they are the best I have seen anywhere with any health department. I have never seen a team this efficient. Contact them. They will help you. Yes, but if you feel some type of way about going to the health department, visit ideserve.net. That's IDESERV.net. Go to the contact tab. Go to the get in contact with us. Reach us. Whatever that label that says contact us, go there. And in the contact box, contact us. Let us know, hey, I'm having this issue and I need to get connected to care. I don't care where you are in the country. We will get you connected to care. That is what we do. We make sure we get you connected to care. If you're having issues in your mental health area as well, I know that's not the theme of this talk, but that's also something that we do. We will get you connected to care, okay? So, know your status. If you find out you're positive, you're connected to care. If you find out you're negative, find out how you can continue to protect yourself and protect your sexual partners, and educate yourself so you can educate your neighbors, okay? I believe we should all be advocates. Why not, right? Why not advocate for healthy living? And lastly, raise your voice. Speak up. Everyone's voice has to be heard. Everyone has to speak up because that's when we'll reach that equitable access. And that's when we'll see the end of this epidemic. 2030 is the goal, you guys. Let's make it happen. So with that, I'm going to go ahead and ask everybody on the panel now. I know World AIDS Day was yesterday, December the 1st. It was also my birthday. With that, are there any events taking place this week, Ricky, that you'd like to share with us happening because of the Coastal Health District or links you guys? I know you guys and Deserve are hosting this conference all week. But are there any other things going on that we should know about?
We are the Coastal Health District, the prevention team. We are going to Star Castle tomorrow here in Chatham County. We are going to be offering free HIV test take-home kits in exchange for free skating. So
what time?
Tomorrow from 7 o'clock to 10. So essentially you'll get you'll receive the HIV testing kit and you will get the skate for free.
Now, does that just include your access to the skate center, or does that include your skates?
Well, that includes access and skates.
Yes, I'm gonna be there. I will be paying because I know my status, but I will go ahead and bring some folks with me. Yes. You said what time again?
7 o'clock to 10.
7 p.m. to 10 p.m. I'm assuming you mean 7 p.m.
Yes, 7 p.m.
Oh.
Yeah, 7 p.m.
I'm not doing this in the morning. But 7 p.m. to 10 p.m. Okay, Star Castle. Is that Mall Boulevard?
Mall Boulevard, yes, sir.
Mall Boulevard in Savannah, Georgia, Chatham County. Star Castle Skate Center, 7 p.m. to 10 p.m. What kind of testing are you guys doing? Are you doing oral quick take home? Or are you doing the NC test?
We are doing the oral quick take home testing kits. It's a mouth swab. It takes 20 minutes. It's free, so I don't see why you wouldn't take it, and you're getting the incentive of free skating. So,
okay, I love that. I love that. And now, if they do the mouth swab and they come up positive, how do you guys support them if they're taking the test at home?
We support them by asking that you all would reach back out to your local health departments.
Okay. So with that, they're going to give you guys some contact information. When you find out your status, I challenge you to reach back out to the health department, whether you test positive or negative, so that they can educate you either way. Okay. Because if you're negative, that's a great opportunity for you to go ahead and sign up for PrEP if you're eligible for that, to protect yourself against HIV. It's a once-a-day pill, and it's a regimen that you can start and take. And if you need to come off of it for any reason, you can contact your provider. They can take you off of it using their program. And then if you need to start on it again, they do the same thing using the guidance of your doctor, using the guidance of your PrEP provider. But it is something that is wonderful in the prevention of the transmission of HIV. Okay. Trying to think, are there any other notes that are helpful? Links, any announcements that you guys have?
We don't have any announcements, but we want to thank you and all of the panelists for the great job that you all did this evening. We know that knowledge is power, so we encourage you to continue to bring forth the knowledge to make everybody aware of what's going on in our community. So thank you so much for this evening and this webinar.
Yes, thank you. Well, with that, lastly, I would have to just simply announce that ideserve.net, that's IDESERVE.net. Did I spell that right? IDESERVE.net. Yes, I did. Go ahead and visit that website now and register for this conference. It's one conference taking place right now. We do it every year, but it's got two tracks. There's a public health track, and the public health track is focused on HIV and AIDS. So you want to go ahead and sign up for that. A lot of people are signing up for both tracks, so do that. The other track, the main track, the theme for this year is Minding the Heart. And what we're talking about there is bridging the gap between what you know you desire to see, what you know you desire to accomplish, that knowing that you have deep inside, bridging the gap between that and the facts in front of you. Because sometimes those things don't agree. But if you want to reach the goal, you've got to bridge that gap. So we're talking about that this year with Deserve. Visit ideserve.net. You can also find the links on Facebook. And what is y'all's website? I believe it's BrunswickGeorgiaLinks.org, but I can't remember, so help me with that. Let me see.
That's correct.
Yes.
That's correct.
BrunswickGaLinks.org, correct?
Right, correct.
Yes. So yeah, you can visit their website to get more information on them. And if you'd like to find out more about our partnership, you can visit ideserve.net. Go ahead and register for this conference, you guys. You don't want to miss out. It's absolutely amazing. Tons of content, and we'll be doing some giveaways coming really soon. So you want to make sure that you're registered, because then we'll be sending out t-shirts, say sex kits, mental health care kits, meditations, meditation audios, and all that kind of stuff. So you don't want to miss out. Make sure you register. ideserve.net. It's free. So there's no reason not to sign up. Okay. If you'd like to become a donor, you can do that on that website as well. But we thank you guys so much for joining us. Shout out to the links for partnering with iDeserve. Shout out to iDeserve's team. Shout out to the Coastal Health District. Thank you so much to Katrina for all the work that you continue to do in this effort and in this fight. Thank you, the participant, the listener, you, the audience, for taking this time out of your day, whenever you watch this, whenever you enjoy this, to educate yourself. Make sure you educate your neighbor. Remember, we're going to end this epidemic by 2030 with equitable access and everyone's voice. Have a good evening.
Good night, everyone.
Thank you. Good night.
Good night.